playing in it. After that, you're probably going to have to shovel and dig yourself out of it, and that shoveling could negatively impact your health. Joining us now is Dr. Chad Rodgers, the Chief Medical Officer at AFMC and pediatrician. Thanks so much for joining us this morning. And Dr. Chad, what do we need to be mindful of when we are out shoveling that snow?
Right. So, a lot of us during the pandemic have been rather sedentary and staying in and staying indoors. May not be in the best shape that we were a year ago. Also, most of us put on little pounds. But, just the activity of getting out and tromping through the snow and shoveling snow takes a lot of exertion, plus the added stress of the cold weather that you need to kind of keep your body warm.
So what are some of the health problems that could overexertion cause?
Yeah, so definitely during snow seasons and with heavy snow, we see an increased number of people who present with chest pain, shortness of breath, maybe even a full-fledged heart attack. And so, if people are exerting themselves and they're feeling that tightness in the chest, or maybe they're just kind of feeling some odd symptoms, it's something to pay attention to.
Wow, so not only heart attacks, but slips, falls, achy muscles.
Right. So probably the number one thing we do see, and with all the sledding, are a lot of falls and accidents. So being very careful. Sometimes because of the snow, surfaces look more even than they are, and you can't see sort of the potholes and the curbs. So just being mindful and making sure you're on steady ground, trying to walk in areas where snow is more packed and shoveled, so that you don't have those trips and falls.
Yeah.
When these things happen, ibuprofen is your friend.
Yeah, I know. I was walking the other day and I'm like, okay, I think the sidewalk dips down here. I think that's the street there. You just don't know. All right, so what are some warning signs when listening to our bodies that we need to pay attention to?
Yeah, that's a good question because, I had personal experience myself. Kind of had some symptoms that I was sort of ignoring. Doctors are the worst at doing that. The main thing is to listen to your body. If you're feeling sort of some shortness of breath that you don't normally have, you're feeling some pain in your chest or maybe in your elbow or your face, those can be signs you have an impending heart attack. So definitely something to listen to your body. Don't just discount things. Pay attention to those symptoms.
All right, and of course it's always important to call 911 as well if you are experiencing a medical emergency. All right, thanks so much for joining us this morning, Dr. Chad.
Thank you for having me.
All right, we'll be right back.